Welcome to the Bromley Adult Education College Digital Drop-In Podcast, getting you back to work with confidence.
Hello, I'm Jill Collier and welcome to episode 38 of the Digital Drop-In Podcast. Today I'm joined by Craig Hollinshead, who is a theatre practitioner, and that's theatre as in hospitals, not as in the National Theatre. So hello Craig.
Hello Jill, how are you?
Thank you very much for joining me today. So I want to talk to you a little bit about your job, and you've told me your sort of correct title is theatre practitioner. To a layman, is that along nursing terms?
It is very much so, yes.
So do you just become a theatre practitioner, or do you work your way through the ranks? So first, I guess, how did you even?
You can opt into it. If you're in nursing, then you can choose either the wards or outpatients or theatres.
Do you get to choose, or are you told?
No, I think nowadays you might be told initially, and then you choose after maybe a year experience. But
what you'd like to specialise in?
But when I trained you had a choice from the off.
Right. So, how many years have you been in this career, roughly?
Qualified in 1997, so if the maths is up to anything, it's about 28 years.
It is, yes. Well done. So, I'm aware that things change all the time, but do you actually go away and do a degree? Is it more like a sort of, do you learn on the job? How does it work?
It's both. It's a degree and it's learning on the job. So in term times you go into university 1 day a week, 2 days a week.
Right.
And in the rest of the week you're on site.
Right. So you are getting a feel for the job right from the get-go.
Yes.
Brilliant. And do they find you your placement in a hospital close to the university? How does it work?
Well, now you apply to the university that are running the courses, and then they find you at the hospital.
Right.
Whereas when I trained, it was the reverse. You applied to the hospital and they put you in the university.
Right. And how long is that training roughly, if you know, because I'm aware things change?
It's a 3-year degree.
3-year degree. And are you on quite a low salary, or are you paying them?
There are two formats to it. You can either be self-funding, or you can get employed by the hospital.
Right.
Even though you're contracted through the university, it's a bit of a complicated thing, but it's
I can imagine.
It's split into two things. So it's, if you haven't got the exact qualifications, I believe, then you can self-fund your course.
Right, I see, yes. I'm very aware these things are quite complex, so I won't push you too much on that because, as I say, it's going to be a case-by-case as to how it's going to work. So you get your degree, and because you have had a feel for, presumably they have given you a kind of a taster of all of the various options. Yeah,
it's a lot of hands-on experience. Yeah.
And did you immediately think theatre is for me, or have you done the other jobs?
I was on the wards for a while. Didn't like that. Also outpatient clinics. That wasn't really my thing. So tried theatres, and
you
that was more my
your thing.
Yeah.
Yes. To say what is the main differences? That's pretty obvious, but. When you're on the wards, obviously, or even outpatients, I guess you're dealing with people awake.
Yeah.
Hopefully. Are you only seeing them in theatres when they're being operated on, or do you sort of have the speaking before and after? Or
they'll come into the anaesthetic room first of all if they're on a general anaesthetic or a local anaesthetic.
And you'll be there at that point?
Yeah, we'll be there at that point. So we'll introduce ourselves, explain what the process is, what they're going to have done. And we give them a step-by-step itemisation, what we're going to do. So, we're going to say, come in, we're going to check your details, and we're going to pop a cannula in, we'll dress that, then we'll give you this drug, which will make you feel like this, etc. And then you'll be asleep. And then the next thing you know, you'll be waking up and it'll all be done.
And do you feel quite a responsibility at that point? Because you're not the anaesthetist, presumably there's an
anaesthetist, yeah, as well.
But you're one of their last people that do you see some people quite nervous, or?
Yeah, well, different people express their nerves in different ways. So some people will come in and not want to say anything. Some people will come in non-stop talking. Some people come in and want to sort of crack jokes and have a laugh all the time. So it's a very it's a job where you've got to suss people out quite quickly.
Yes.
Because some don't want to talk, so you don't want to talk to them, you know. So it's a matter of sussing them out quite quickly and putting
judging.
them at ease. Yeah. Whereas on the ward, you get that time to know them. They can be on the ward for days, weeks, months.
Yes.
So you've got that time to build up that rapport and know what sort of person they are. But obviously when they come into the anaesthetic room, everyone's nervous because it's the fear of the unknown, you know.
It is, yeah.
So it's trying to calm them down and just trying to suss out if they want to talk, if they don't want to talk, and how much interaction they want.
I've noticed a huge difference over the years from when I had operations as a child until more recently. And I don't say you're aware it's more of a business, but you know, they're asking your name, your date of birth, do you know why you're here? You know, it seemed quite a sort of a strict list of questions that they go through to make sure that, I guess, they've got the right person. And dare I say, even when I had a broken arm, they still put a great big arrow on the arm that was broken.
Yeah, they do that now because
to make sure.
Yeah. They have a checklist now, which is called the WHO checklist, which is the World Health Organization checklist.
Oh, right.
So it's a kind of a very differently from specialty to speciality, but basically they want to know your name, your age, date of birth, hospital number, just to check we've got the right patient.
Yes.
Because obviously nowadays, like you say, everything's changed. Litigation is quite high on the cards.
Yes.
So we have to make 100% sure we've got the right person, we're doing the right operation. And as you say, they draw an arrow on you. That's to make sure we've got the right side. So there's been issues where people have, in the past, where people have operated on the wrong limb. So we should have operated on the right and somebody's operated on the left. So there's numerous checks before you actually get to the procedure, the start of the procedure.
And do you know what prompted you to want to go? I mean, I know you're saying you didn't like the others as much, but do you know why? Is it more of an adrenaline thing working in the theatres, or?
I think when you start off, it is quite an adrenaline rush, and you see things that no one ever sees. You know, if you're in the operating theatre, things are going on. I've worked in various specialities, from gynae and obstetrics, people having babies, cesarean sections, neuro theatres down at King's College, so you're seeing all operations on the brain, cardiac also at King's and St Mary's in West London, and liver transplants at King's College as well. So
it's amazing.
These things are fascinating things that you would never get a chance to see otherwise.
Yeah, I mean, that sounds almost a promotion in my simple way than seeing people in outpatients. But is it all the same grade as far as a practitioner is concerned?
There are. You start off on a specific grade, and then with your experience and time, you build up. But it's also for courses, Jill, really. Some people don't want to see all the insides of people, and some people do.
And what is the grade sort of width, or what is the lowest grade you go in as a nursing practitioner to the highest grade? I don't know how
You'll
many.
be if you're hands-on, obviously, with most jobs, the higher you get up, the less actually you do the job you started off doing.
That's the problem, isn't it?
Yeah, it is. So you'll start off on what they call band 5.
A band.
Yeah, and then within that band, there are various pay points, which is, I think, about 4 points per band.
Oh, right.
So you get increments, and then you go up to a band 6, and then that becomes with maybe a little bit more responsibility and a bit more paperwork and a bit more control and supervision. And then a band 7, there's less hands-on and it's more office-based.
Right. And that's a shame sometimes, isn't it? Because, taking it back to a different analogy, but they always used to say a great salesman doesn't make a great sales director, because if you're good at doing your job, that doesn't mean to say you're good at managing other people, or indeed you might not want to manage other people. You might enjoy doing what you do, but it's almost like a natural progression, isn't it?
Yeah, exactly. You can if you get to, like, say, band 7, which is, like, say, mainly office based, you can at your interview for your promotion say you'd like to split it. So maybe you want to do 3 days in the office but have 1 day back in theatre.
Oh, that's good. That's nice flexibility then, isn't it?
So you don't actually lose all your skills and you keep in touch with what's going on at the front.
So, time-wise, are you always on shift work, or does that not really work with operations? I don't know.
They do shifts to cover emergencies,
yes.
but your standard day for, like, elective cases, the ones that have been planned in advance, you're going to be starting work around about 7:30 and finishing around about 6 p.m.
It's a long day then.
It is, yeah, very long, yeah, because there's nowadays, as you know, the waiting lists are so long, we try and cut them down. So if you're working in, like, a main theatre, then you're going to be doing shifts, so you're going to be doing day shifts, and you're going to be doing night shifts, and you're going to be doing weekends.
Right.
Not every weekend.
So it's a commitment, isn't it?
Yeah, so it's...
And I say how many hours a week, because if you're doing shifts it might not work out like that. It might be how many hours a month that you then divide down. But what is the average hours, if I could say that, of a working week? It's got to be a lot, hasn't it?
Well, the average is, because if you're doing, like, say, 7:30 till 6:30, you're going to be doing 4 days a week.
Oh,
so you're not doing the full 5. Yeah.
Right.
But so your average is around about 38 hours.
Oh, so it's like a normal sort of working week. It's just 4 long days potentially.
Yeah. So if you do nights, you could do maybe 3 nights and then have 2 or 3 days off and then come back and do 3 or 4 days.
And do you enjoy the variation of that, or would you prefer 9 to 5, Monday to Friday?
When I was younger, I used to prefer the variation, and then having kids, nights became a problem. So now I usually work in elective theatres now, which are just Monday to Fridays.
Right.
7:30 till 6. If you're in the emergency theatres, then obviously you're going to have to cover all 24/7 basically, because obviously you never know when anything's going to come through the doors that needs urgent attention.
My limited knowledge of sort of shift work in a theatre is you have to be within a reasonable travelling distance, don't you? When you're not sort of shift, when you're on emergency cover.
Yeah, if you're on call.
On call, that's right. Yeah.
Yeah, you have to be within an hour.
Oh, an hour. Oh, that's some distance then, isn't it?
So it's and especially, you know, if you're on call, usually you're on call at night, so it's quite quick to get in. If you're coming in at 2 o'clock in the morning, there's not much traffic about.
Right. So that's not an issue
it's not
generally.
an issue, no.
And as far as digital skills required in the NHS, have you noticed over a period of years, as you have been practicing for so long, a kind of a shift? I mean, I can remember you'd have like a folder at the end of your bed almost, where people would come in and write notes. Then I seem to remember sort of not necessarily iPads, but tablets being carried around. Now often they're doing it on their phones because that's connected. Have you noticed a difference in the digital skills required to be in your profession?
Very much so. When I first started, everything was handwritten and on paper, and then you'd have a click typewriter to do discharge summaries and things like that, things that get sent off to the GP. The actual letters would get posted off to the GP, whereas now everything is on iPads or on computers. You still have the notes, which contain printed letters or copies of X-ray reports, blood test reports, something like that. So some things still are on paperwork, but most of it is all on computer now, which is good, because if you get a patient come in, you can just type up their details and it'll come up with a full history of everything they've had.
Yes.
So, and you're not going to lose that because a paper's fallen out of a file somewhere, or the ink's faded, or something's been ripped out. It's all there basically for everyone to see in quick access, which helps if you're in the emergency room and somebody comes in, and if you've got their details, you can just type it in and it'll come up with their past medical history. Yeah.
But is it, I don't say hospital related, is it sort of group related if you're in the King's group or the, whichever group you're in, or is it across the board NHS?
It's whichever trust, basically.
Trust.
But you can contact another trust, and you can just say, oh, can you email me the past medical history on Mr. So-and-so or whatever, and then they can...
So things have come on a lot then, aren't they? Because to be able to get the information from another trust could be, I was thinking maybe another part of the country or something like that. You can still get the information quite quickly then.
Yeah.
And as working in that line, is it your responsibility to get your digital skills up to scratch, or is it the trust's responsibility to put training courses on? How does it work?
It is a trust responsibility, but because obviously they've got so many people trying to get on these courses at the same time, you can wait several months. So if they bring in a new system or new software, you try and either teach yourself, or somebody will come around and give you a quick information session on how to use it. And so you know the basics for a while until you can get on the course, which could be anything up to as much as a year before your time can come. And not only waiting for that, but it's if they can spare you, because obviously if you're on a training course, you can't be in theatre.
I think that is
so that's one of the big problems.
Yes, again, my sort of limited knowledge of friends that work in our local trust, which is the King's. They had new software installed probably 2 or 3 years ago now, I think.
Yeah, it's Epic, isn't it?
Epic, yes, which they decided wasn't so epic at the beginning, because nobody really knew how to use it, and that wasn't because the software supplier was reluctant to show them. It's because nobody had time to attend these courses, so they were kind of winging it a bit and doing their best they could under the circumstances. But I think they, quickly got it under their belt. But it is such a big leap when one does go from one piece of software to another, isn't it?
Yeah.
So I think it's quite interesting, really, how digital skills have kind of eked their way into so many jobs. And to be a brilliant nurse wouldn't necessarily come with being brilliant at IT, would it? It's,
no, not in the old days. You wouldn't even think about it.
And you wouldn't think about it, whereas now it's something that's got to be borne in mind. I guess it happens more naturally for people training now, because all of the work they're handing in is going to be, centralised on a computer and everything else.
Exactly,
so I guess anybody wishing to go into nursing now would potentially have digital skills, that they would just then learn the appropriate software. But it can be quite a leap for some people that have never really had that kind of training, can't it?
It can. It can be very very confusing for a lot of people, especially people of my sort of length of service. We never had any of that.
No.
And then that's coming gradually. Well, I say it started off gradually, but then it suddenly just seemed to explode, and
it's picked up momentum in the last few years, has it?
Computers everywhere. Every anaesthetic room's got a computer. Really? Every theatre has a computer. Every recovery bay has a computer.
And is that for you to be documenting live time? I mean, let's say the recovery room, for example. Are you having to document when they come round, or if they've had any symptoms? What are you having to document at that point?
Yeah, so you will document if they come into recovery and you're working in there, then you'll document the time they arrived, what they've had done, if they've got any wound dressings, if there's any signs of blood on the dressings. If there is, and you need to document the rough size and the time.
Gosh,
and then you keep monitoring that size. Their conscious level, if they're conscious and they can speak, their pain level.
So it's all
there. If they've had a anaesthetic block, if you've had the nerves numb to your arm, let's say, they need to know what level that block is. Are you getting any sensation back in your fingers and your elbow? Can you move? Can you feel?
So, I mean, it is excellent that there is so much information so readily available for the next person, or when they get back to the ward, for that person to check that documentation if ever they're unsure, I guess.
Yeah, exactly. And you can see what medication they've had, if they had to have painkillers in recovery, what did they have, when did they have it, so you can work out when it's going to start acting. So obviously various drugs take longer to different lengths to act. So people on the ward can think, okay, well, they had X drug at like 12 o'clock. That should be kicking in around about now.
Right.
And so they can, if the patient is still saying they're feeling nauseous or they're in pain, whatever, depending on what the drug was, they think, well, we're not going to double up on that because it's going to start kicking in soon.
Great. And would you say nursing is a good career to go in? If you had your time again, would you do it?
Financially, no.
Right.
Because obviously, I think everybody, it's no big surprise. Everybody knows that nurses are
overworked and underpaid.
Yes, to use that. So I think if you're not money orientated, it's okay. Which most people, when most people go on, they are young and they're not that bothered about thinking about getting a mortgage or doing this, that, and having kids at that stage. But then, obviously, as those things come into your life, you've got to think about other things, which is why a lot of people leave nursing. Is it?
My next question was going to be, what is the, the rate of, is there plenty of jobs available at the moment? I mean,
there are plenty of jobs available, but obviously they're all in different sectors of nursing.
Yes.
Like, so that, there's lots of sectors you can go into. But lots of people, when they get older, they want kids, they don't want to be doing shifts, that sort of stuff. And, and they want more sort of 9 to 5 jobs, Monday to Fridays, and hopefully with better pay. So this is what people with nursing skills now, it's losing a lot of highly skilled people.
Really?
Yeah, because obviously they've got to that stage, they've been there for several years, and then okay, right, I'm not advancing, there's no, it's not like there's loads of band 7 jobs, band 8 jobs to come up, they're not coming up all the time.
Right.
So they kind of look outside and they think, well, they look what transferable skills they have, with, like I say, they've got their IT, they've got sort of time management, people management, various things like that, and that can be extrapolated to other jobs.
Yes.
So I just think, well, why not get a better job with, not sort of an exciting, interesting job maybe, but just sitting in an office, but you're going to get maybe £10,000 a year more.
Right.
And you've got to get your priorities sorted then if you've got kids and things to support, and mortgages.
Do you feel, I mean, as a teacher, you almost feel you're giving back to the community. Again, it's not the best paid, but there's a certain fulfilment of seeing people, grow with their knowledge. Would you say nursing is sort of like that in a different way, but you're kind of giving back to the community in any way?
Yeah, it can be very rewarding, but lots of times, as in a theatre aspect, these people come in, you meet them virtually just before you're going to put them to sleep, basically. So you have a quick chat, and then they're asleep, the operation gets performed, and then they're out into recovery.
Yes.
So even though you know what you've done is good, it's going to be rewarding for them, you don't actually witness a lot of
that's true.
Of that, basically.
Whereas maybe that's why when you are on the wards or something like that, you do see the gradual improvement. And certainly when I've been in to visit people recently, you see them being so helpful, so kind, and they've got to know that patient quite well, and don't even ask them some things. They just know what that patient's going to want. So I guess that's the upside, maybe, to being on
sometimes
the
we
ward.
do have like repeat customers, as we say. If they need certain operations done in stages.
Yes.
So they do stage 1 will be this, and then stage 2 this, and stage 3 that. So you do get to know some of them, but on the whole, it's a very much you just basically in 5 minutes of conversation with them, and then that's it.
Yes.
Yeah, you never see them again.
Well, I think it's a career that a lot of people would want to consider. The whole medical world is moving at such a fast pace that it's something that many people would want to consider. So I will put up in the notes to this podcast the kind of the availability of jobs and the training and things required sort of currently now. But I think it gives a good insight for people to hear from you. I certainly didn't know that you kind of specialise from, inpatients, outpatients, theatre. It just gives people a good idea of the options available.
Yeah, so it's definitely worth considering. And now, like with advancements, now we have lots of robots in theatres that are, the surgeon sits one end of the room and the robot's with the patient.
Gosh.
And he's controlling the robot on like a little joystick kind of thing, like almost a gaming console.
Amazing, yeah.
So that's
you get
all
to
going on
see
ahead now. So there's
all of
dramatic
these
changes.
advancements.
Yeah.
That's fantastic.
It is.
Oh, well, thank you so much for your time, Craig.
You're welcome,
That gives
Jill.
me
Thank you.
food for thought. And as I say, I'll put the appropriate information up that I can find as to, how long training is and what sort of availability of work there is. But thank you very much.
You're welcome.
Okay, goodbye.
Cheers. Bye-bye.
This podcast has been produced by Jill Collier for Bromley Adult Education College. For help with all your job searching needs, do visit one of our digital drop-in venues. Our free sessions are advertised on our website at www.baec.ac.uk or telephone 0208 659 7976. We offer free use of computers for job searching, advice on creating a winning CV, plus lots of short training courses to gain skills in the digital world. Don't forget to subscribe to this podcast to receive notifications of new episodes.